Do you have ED? I mean, come on, it's not that hard. Do you or do you not? I'm talking about an emergency room department. The hospitals convert 15% of all emergency room department ED patients for treatment. And they're making about a 7.5% margin if it's low-paying government insurance like Medicaid, Medicare, and a 38% margin if it's high-paying private insurance. So there's a big difference in margin, and if your overhead's not right, you might be doing Medicaid and Medicare for a loss. But my gosh, they have an emergency room. That's why your oral surgeon, did you know your oral surgeon has ED? And your endodontist? Tell them I said so. Because every oral surgeon and endodontist has at least one or two operatories that are never used, because they get about 80% of all their business from their top 10 referrals, and then the other 20% is from all their other referrals. And if you're one of their top 10s and you got if your patient has an emergency, your oral surgeon or endodontist will see them right away, because they do not want a guy like you to start using or getting used to another endodontist or oral surgeon. So they'll always see their emergency rooms, and that's why they make the big bucks. Oral surgeons are like $450 a year, endodontists are over $310, while my general dentist homies are all the way down to like $180. It's because the patient calls you and you say, oh, I don't have one of these extra operatories. There's 168 hours in a week. In 32 hours, you're only open 19% of the week. So you gotta have lots of operatory extras for the flow. But you always tell your patient, oh, I can't see you today because I don't have an extra lane to see you. And then you tell your Patterson, Shine, Benko, Burkhart rep that you can't afford it. Well, hell no, you can't afford it, because you never get the emergency room patient in and then convert them to an expensive root canal buildup and crown. You're so busy doing a filling on Mrs. Wimbledon and doing a recall that you can't see an emergency. Emergency is where the big monies is, and treat other people like you want to be treated. If you were having an emergency, wouldn't you want to be seen? So get an op. Keep adding operatories until 2 out of every 3 days, one operatory was never used. And you just make that your emergency room operatory, so that you can finally have the ED you've always wanted.